So I've been in this role for a year now, so it's a brilliant time to be thinking ahead for the next 12 months and making sure that finance and operations are working hand in hand to achieve all of that. So in terms of those priorities, alongside the consultation on the 10-year health plan, we're also taking action to address more immediate issues. So obviously right now, winter, and then also substantively elective waiting times and the productivity of the NHS. A few weeks ago, we launched our plan for winter, which includes things like upgrading 24-hour live data centres to manage demand, strengthening same-day emergency care, which already had hugely positive impact last winter, and also offering more full services for older people, which I'm extremely conscious about since my dad had a couple of falls in September. On productivity, the productivity of the NHS and indeed the wider public sectors took a significant hit during the pandemic after years of strong improvement. And in the NHS, we're tackling this challenge head on, which we absolutely have to do as such a large part of the economy, including redesigning how we deliver care, bringing treatment closer to home and taking advantage of all of the latest technology and innovation. And I have to say, it's a brilliant time to be in the health sector with all of what's available in terms of innovation. And just to give you a sense of that, NHS staff have already delivered almost 12 million elective treatments so far this year, which is 570,000 more than the same year pre-pandemic. So we're already making progress on a range of issues, including electives. And the impact of that is, for example, the number of waits longer than a year for treatment has fallen by more than a quarter on the same period last year. And I want to talk about how finance colleagues have an enormous role to play on that performance improvement. For example, spending on agency staff is lower than at any point in the last 2 years. And on productivity more broadly, the NHS has made 2 billion worth of efficiency savings just in the first 5 months of the financial year. And all of those efforts mean that NHS staff are able to focus on the best use of taxpayer money in delivering care and improvement for patients every day. So this critical role that finance colleagues can play in having to navigate the challenges of financial constraints on the system and making sure the NHS does what it needs to do every day for patient care is indeed, a complex one and certainly more challenging this time this year than it was in previous years. So I'm really conscious of the challenges at a local level and keen to support and indeed hear from finance colleagues about what they're already doing. From my strategic perspective, I would start from a position that says sound finances are a foundation of better productivity and better patient care. So I believe that we cannot improve patient care without also spending taxpayer money effectively and improving productivity. And I don't think we should think about finance improvements that aren't also linked to transformation and improved patient care. We can do this both together, and that means improving quality and not just productivity of that patient care. So, for example, NHS finance teams work to ensure resources are in the right care setting to cut duplication, helps free up frontline staff to spend more time caring for patients, and makes it easier for patients to access prompt and high quality care. So if we take, for example, in Devon, they created 1,100 extra spinal clinic outpatient slots a year, and that's helped reduce the number of long waits for treatment by simplifying and improving the process of booking in and making sure patients can get a slot that works for them. The use of Saturday clinics, which Devon again has done on dental care for children, and is also happening in central London. So in one hospital there, they do as many procedures in a single Saturday as they would normally do in the entire working week, because they're changing the way in which they work and the way they use theatres. But equally, we know we have to do even more than that. We have to go further and faster and ensure any area of innovation in the NHS becomes the norm across the entire health service. So when we see something good, we don't just say, well done, we say, let's help another 10 systems do that over the next few months. And finance colleagues who see quite a lot and I think are quite well networked across the NHS can play a big role in identifying those kind of improvements that are driving both better patient care and better use of money, and make sure that's supported and driven across the rest of the NHS. So I think anybody who has either worked with me or knows other people who've worked with me or heard me talk about the work we did during the pandemic knows that the way that we use technology and data to improve patient care every day and make sure we've got the right resources in the right place for patients at the right time is at the heart of everything that I do, including in this job. And I think the thing perhaps I've talked a bit less about is how that can drive efficiency. But what I've seen over the last year in the role is lots of good examples. And I think it's absolutely critical we note those and figure out ways to share them, extend them, and embed them across the system. So if I give you a couple of things to think about, for example, South Tyneside and Sunderland NHS Foundation Trust have seen huge reductions in the number of long stay patients using their implementation of the federated data platform to manage discharge processes. And what it does is give care teams much better real-time oversight of tasks and demand in the patient journey so they can plan ahead. And that's freed up senior nursing teams to oversee the more complex discharges, which really need hand-holding. To give you a sense of the scale there, between February 23 and February 24, the average number of delay days per month has reduced 37%. And that's incredibly meaningful in terms of staff time, but also patient time, and particularly for frail elderly patients, where there are lots of contraindications for them remaining in hospital longer than they have to. That has an enormous improvement in patient care associated with it, or quality of patient care. If we think about other opportunities, 75% of the adult population now carry the NHS app, and that's a massive growth since the beginning of the pandemic. And that's allowing an average of 4.1 million repeat prescriptions to be ordered every month, including me, which cuts down on the process both for patients and clinicians. We have 95 hospital trusts who are enabling patients to view their hospital referrals and appointments in one place via the app. And that equates to about 77% of acute settings that are enabling a form of outpatient appointment management via the app. And obviously, there's a lot further to go with the app, and I'm really excited to see what we can do with it going forward. And if we then think about it from a system perspective, 95% of providers are submitting data via faster data flows. And that gives us really high quality data that I can look at, my team can look at, which helps us make better decisions and reduces the burden on providers in that we're not asking them to fill in lots of data on paper forms, which is both a terrible use of time, but also prone to quality issues with the data. So over time, I'm excited to get much even higher percentage of acute providers, but also mental health, community, and indeed possibly in the future, even primary care, having some level of automated data collection so that we reduce the burden on staff, but increase our ability to make great decisions.